You can't run a country like a corporation because it's not that black and white.
This is the richest country in the world, but we got homeless. We got poor people that can't survive.
And if you went in and you asked your broker about what effect this bill, the big beautiful bill, would have on their benefits and their service, and they told you, don't worry about it.
Yeah.
Look for
a rude awakening. The most important thing about your SNP plan is that you take advantage of all the services that are preventative. Preventative. Hi, my name is Santiago Cabasa, and I am the CEO of Medicare Professionals, located at 929 North Broadway in White Plains, New York, 10603. Our office hours are 10 a.m. to 5 p.m. Monday through Friday, 10 a.m. to 4 p.m. Saturdays, and Sundays we're closed. Our concierge services include Social Security, Medicare, New York State of Health Insurance, disability, SNAP, HEAP, and all sorts of other things that are related to social services in New York State. So come and see us, drop in, and we're sure to assist you with all your needs. Thank you, and I look forward to seeing you at our offices. Welcome to Part 2, Season 2 of the Real Deal Health, Wellness, Insurance, and Lifestyle Podcast. First things first, my name is Santiago Cabasa, CEO of Medicare Professionals, located in White Plains, New York, 929 North Broadway. We help people with Social Security, Medicare, New York State insurance, as well as many other things. So if you get a chance, come and see us if you need help with any of those social services needs or anything like that. This is Juan Cabrera.
Juan Cabrera, health insurance store. Everything that Santiago just said, ditto.
And this is Daniel, and we won't mention where he's from, but go ahead, Daniel, tell us.
My name is Daniel Hope. I am one of the broker account managers for one of the well-known Medicare Advantage plans in New York.
In New York State.
Correct.
Yes, and today we are going to talk about, let's all make a cheer, let's all cheer for annual enrollment period, yay! Annual enrollment period, but first we got to go and hit on a couple of hot topics. One, in one of our episodes recently, we talked about the homeless veterans and things like that. And everybody that has commented, I mean, most of them were positive, but for those of you out there that have negative comments, don't come at me with gripes and grievances. Come at me with resolutions and solutions, because that's what this show is about. It's not about gripes and grievances. We're all about solutions, giving us your ideas on how we solve these issues. Homeless veterans, Medicaid, and what's going on with the big, I'm going to call it one thing. You could call it whatever you want. I'm going to call it the big bullshit bill, because that's what it is. It's a big bullshit bill. So let's dive right in. We're going to talk about health insurance and what the upcoming AEP is going to look like. First of all, what are Juan, I'll come to you. What do you think the effects with the BBB is going to be?
Well, we had spoken about that. I think that the effect that we're going to see is going to be the collateral damage in terms of the cuts for certain programs that a good segment of the population or the population that we serve,
yes,
they depend on. So it's going to be a little bit dicey because I think that it affects everybody. I think that customers are going to have to adjust to what is going on and the reality of things as they are. But also, the insurance companies are going to have to the carriers are going to have to make some adjustments in terms of the products that they're offering, what will and will not be covered. And there's also going to be a big hit in the cost sharing, I would imagine. Now that those programs are not available, the consumer's going to have to put out a little bit more.
Correct. And everything that you stated is 100% accurate. But I want to emphasize, the carriers, the Medicare Advantage plans, or regardless of the type of carrier that the seniors will have, they will take on a larger share on, what they would have to pay for, specifically for the members, which are, of course, consequently affecting the benefits that they can offer and the services that they can offer. So it's sort of a ripple effect that this bill is causing. Of course, I'm not going to say that it's 100% negative. I cannot say it's 100% negative, but of course it is going to have many negative effects, more than positive for clients.
I would say more on our customer base.
Absolutely.
Especially if you're working in low income areas, it's really going to have a residual effect on them. especially when we get to the portion of when we get to social services when it comes to Medicaid for seniors.
Absolutely.
We're already seeing the effects in rural counties, right? Hospitals are closing,
Correct.
clinics are closing upstate. What I think is people in the federal government think that there's only a certain demographic that's going to be affected. Well, I'm here to tell you, it's across all demographics because the word poor doesn't have a color. It has a demographic. And when I say demographic, you could be whatever you are. But if you're under the FPL or right at the FPL, which is the federal poverty level, you're going to be affected by this bill.
Poor is a classification.
Yeah.
It is. If you fall below a certain income, and a great deal of the population that we serve falls below that income. Look, I'll tell you one thing. Poverty doesn't care if you are white, black, purple, pink with blue polka dots. You're poor. It is what it is. But I wanted to piggyback on something that Daniel said.
Yes.
And I think that it's important for us to point out. And I wanted to kind of direct this question at him. My brother, you know how I feel about you and the company that you represent. I think that you guys are racist.
Okay.
But as the insurance companies begin to bear more of this, more, as you said, the burden of offering, and particularly those ancillary programs, because Part
when you
C,
say ancillary, tell us.
When we talk about Part C programs, the Part C programs really are all about the ancillary, the dental, the OTC,
supplemental benefits.
The supplemental benefits. Thank you for that correction. Most of those, when Santiago and I were looking at it, we were like, oh shit, we're going to see a lot of those programs, particularly the OTC and the dental, because those will be the first that will be cut. We all know that.
Yeah.
We're going to begin to see reductions in those. And for the poor, and we go back to that classification, those extra really makes the difference between buying food.
Yeah.
Okay.
And having insurance.
And
And I'll piggyback on that. I have clients in certain areas that have to choose. They have to choose. I mean, not so much the people with Medicare and Medicaid, but the people with just Medicare, and say they don't have a LIS. And not to speak to any plan, but most plans right now, the ancillary benefits are going to have a premium. When we talk about dental, when we talk about, and some of them have went as far as, and this really pissed me off.
Right.
Some of them have went as far as to make tier 2 deductible wise.
Yeah. Well,
I couldn't believe it.
I
could not believe that somebody could walk in, try to get a generic for $12 and end up having to pay I won't even say the amount because then you're going to know who I'm talking about. Like over $600 before they get a generic. That is just ludicrous, ridiculous. And, I'm straight up with my clients, and I'll tell them right away if this is a good fit or not a good fit. And I have no loyalty to any carrier. My loyalty is to my clients and what's best for them. I cannot agree with it would be a malfeasance. Oh, big word today. Malfeasance on our behalf.
Okay.
To keep our clients in a program that does that to our clients. Agreed?
After this segment, you're going to tell me exactly what that means. But
what, malfeasance? It's a lawyer.
It's
like a lawyer term. All right, I'll let my alter ego take that. That is bullshit. Bullshit that y'all would do that. And it looks like, and to me, you guys don't want Medicare recipients in your plan. I'll just say it like that. You don't.
I said this before. Listen, insurance companies are in the business of, unless you're a non-for-profit insurance companies, we won't get into that.
We won't go there.
We have, but that's a totally different animal.
Is that negative or positive?
Well, my thing is, look, if you're an insurance company, okay, and you're going to act like a non-profit, but meanwhile, you're making a lot of profit, how it's channeled out. Okay. You know what? I'm going to leave it right there.
Yeah, leave it. Why, you want to speak to that?
No, because that'll bring me to a whole different topic and a whole different anger level. But here's the thing. As the insurance companies are struggling to provide these programs, and Daniel, I know, and you know it from an actuarial point of view, it's, oh shit, but you know what? Yo, how are we going to deal with this?
Yeah.
The consumer's just going to have to pay more.
Yeah.
But the big balance, I think, for some of the carriers is going to be, well, you know what? How do we reduce these services or increase the out of pocket and still retain our members?
Yeah.
Because the competition margin is very,
slim.
very close for a lot of the
Very
carriers.
slim. Mhm.
But wouldn't you say it's, I'm going to ask you this, it's based on where your population is,
Correct.
right? Wouldn't you say that? Like your major, I mean, we all know insurance carriers are, not the individuals that work for the insurance carriers, but the carriers overall, the CEOs, the actuaries, they're in it to make money.
What insurance
Do you
company
agree
wants
or
to-
disagree?
What insurance
All right, I
company
don't want to
wants
look at him
operate-
as asking
what
that question.
Insurance company
Doesn't want to make money. But what I
which
want to
one
get
wants
to,
operate in the red.
yeah.
Which one?
Well, we had a
Oh,
couple.
we're in the red today.
We had a
We're
couple
going
of carriers that were disrupted, and they're just coming back. Wink, wink. We know who we're talking about. Sorry. And I love y'all. I love y'all though. But you know, it's just you know, I would say because of the lax mentality of our population.
Yeah.
The problem is that they don't utilize the preventative medicine enough.
Yeah, we spoke about that.
Because that's why the increase in care is because a lot of people, and I'll specifically say in certain areas, will not go see their doctor until they get sick. And by the time you get sick, it's too late because you're going to end up where? In the emergency room, in the hospital.
Where the insurance companies don't want you to go.
Right, because that's just the way it is. So if, you know, when I look at the BBB, the big bullshit bill, it's basically the sick versus the healthy. That's all it is. Because there's a pool out there that is eating up a lot of the dollars when it comes to plans. Correct? Go ahead.
Correct.
Go for it.
Just to backtrack. Related to the insurances, of course, I'm gonna have to come to the the defense of the insurance companies, because my insurance company is or the insurance company that I work
as
for
a whole
is a not-for-profit.
Okay.
All right.
All right.
So of course I completely understand. People do know the salaries of a lot of the executive leadership, and of course the ultimate goal of a business is to make money. But as a not-for-profit, of course, all the money that we do make goes back into the company. That's number one. And number two, we're just operating in a time period where there are so many changes. Insurance companies, whether you're a corporate or you're a not-for-profit or non-profit, the insurance companies do have to pay keen attention to how they allocate those resources.
Gotcha.
So, of course, you guys do know, of course, they might impose costs on particular clients while scaling back on benefits.
Certain things.
But everything is taken into consideration.
Right. But but the preventative end of everything is still covered at no cost. So if you need to go see a dentist, for cleaning and some x-rays, that's still free.
Correct.
Even though, so take advantage of it. I've heard things like some carriers saying, yo, we're going to have to get rid of silver sneakers because people don't understand that you're paying for silver sneakers like at an exorbitant rate, and people don't use the gym.
Correct.
Yeah.
So what would be the reaction? I'm going to have to get rid of it because not enough people I'm paying for are actually using the gym.
And we're looking at that now. I mean, we're looking
it's already started.
Yeah,
I've seen some carriers get rid of it. They get rid of silver sneakers as a whole and change it to something else, and a lot of gyms don't take it.
Yeah, and the other thing might not be as favorable or as easy to use.
Right.
You have carriers that are moving away from one fitness provider,
right,
then just going to a different one, and then they see that after 6 months the new fitness vendor is not good,
right,
so then they go back to the original one. Right. It's not silver sneakers.
I mean, I don't know if you could talk about that, but like, what is a yearly cost?
I can't remember.
Based on the numbers.
I can't
remember. He's not,
sorry. All right.
It's one of those.
But I would imagine if your member, if you have a population in a certain area, and they're using, you have silver sneakers where they're using basically franchises. I can't imagine, most of those memberships are like $10, $14, $15.
Correct.
Right. So, but then you got to base it on, like you say, the word actuaries, like they got to base it on what they think.
Correct.
Or how many people they think will actually use it.
The whole, when we talk about it, and it's very clear that there's a direct relationship between actuaries and utilization costs.
Of course.
So it really is a fine line, and it has to be balanced, because you have to always obviously balance what's coming in with what's going out.
That's right.
And let's all remember the government-sponsored programs.
Yeah.
Dealing with sick people who are getting
That's
sicker.
what we were talking about. That's the pool.
Yeah.
The
and
pool,
it's going to cost you more money as they get older.
Right. And I'm gonna get to that. But people, use the gym, or you're gonna lose the gym.
And the gym is part of preventative care.
Yes,
So
it is. Preventative care. Let's go through. I'll go through the line. Preventative care. Seeing your doctor at least once to twice a year is free.
Correct.
Getting your mammograms is free. Getting your PAPs, your SMAMs, your smears, your flu shot, as long as it's done at the pharmacy.
Correct.
Because if the doctor does it, you're gonna pay for it.
Correct.
So make sure you go to the local pharmacy that your carrier is in line with. So if you see on the back of your car your carrier is in line with CVS Caremark, go to CVS.
Absolutely.
Get your shots. And please, please don't get disillusioned. Don't get told fake stories about how vaccines are hurting people. Oh my God.
Do your research.
Oh my God.
Do your
how
research.
Tylenol is going to hurt people. Oh my God. Dr. Oz, you're from Oz, B. I can't believe it. I'm like, yo. and then, I mean, come on, man. Show me some numbers. You're telling me that pregnant ladies are taking Tylenol and their kids are getting autism. Come on, man. What?
I think
they make me sick. I mean, they just drive me crazy. So if I'm an adult and all of a sudden, I got pain, and my doctor is one of those that says, Tylenol's bad for you. Let me put a prescription down. Oh my God. All of a sudden, the prescription he's writing is 1,000, 2,000 milligrams, and I'm in tier 3. What is that? That's a deductible I got to hit, right? Unless I have LIS or something like that.
Correct.
All of a sudden, my doctor is scared of me taking Tylenol. Guess what? I think I said this in one of the earlier surgeries. Find a new doctor.
Let's go to where the facts are. And Tylenol has been around for years.
Yeah,
and
come on.
It's one of those things that most of the carriers included in their OTC catalog and their over the counter, because doctors have been suggesting Tylenol for years. And for the most part, it does its job. It works. So I think that it was a little bit early to release that. And I think that's almost like, and I view it the same way as you saying, well, you know what? You shouldn't board a plane because planes crash. And if you take a look at the statistics, you have a higher chance of being struck by lightning.
Yeah.
Okay.
It's more like
than being in a plane crash.
It's more like killing a bear, putting him in the back of your car and dropping him off in Central Park, right, RFK? Wow. All right. So I think we hit a little bit on market disruption, or you want to go deep?
No, I want Daniel to hit more on this topic.
On which one?
He's been quiet, but today I'm going to make him talk, man.
What, market disruption?
I want to hear what the insurance, what the carriers are doing.
Let me give you a little. Let me put a little win behind you.
Let's do it.
So market disruption. When we talk about market disruption, well, we're specifically going to target New York State and New Jersey.
Correct.
Because that's where Juan and I work.
Correct.
Yeah. And that's where a lot of I would say the majority of my clients are Westchester all the way up to the Canada border. Thank you, Canada, for watching the podcast. Yo, we love you. We got a lot of people from Canada. Thank you.
Quite a few.
Yeah, definitely. If you want to leave some comments, tell us where you're from, and definitely we'll big you up. Canada. Okay.
Love Canada.
All right, but hey, I like hockey. No. So basically, let me refocus. All right. So when we talk about market disruption, and it aligns with the BBB, right? Because plans had to take into account what the effects on Medicaid in certain states would be, and they had to look at it. So I think the last count from New York State was that there's a possibility of what, 300,000, a couple of 100,000
for our audience.
seniors.
Santiago calls it market disruption. I'm going to be real. I call it the oh shit factor. It's like,
all right, well, All right, so you want my alter ego to
There
say
you
it.
go. Bring your alter ego.
You just said it. All right, but we're looking at with the probability of New York State not getting I think $80 to $90 million in order to back up the Medicaid system, you know, and then the disruption would be from what the last
reduction in Medicaid.
reduction of people that are on Medicaid.
Correct.
Right. So, for instance, what was it a few years ago for seniors? I think the Medicaid it was at $950, and now it's at $1,650. So this disruption could either slide the scale back down, where if it's imagine if, for instance, the sliding scale for Medicaid for seniors next year was $950. How many people that we have with Medicaid right now? The prediction was about 200,000 to 300,000.
Yeah.
Seniors would lose their Medicaid. The other one I was looking at that really disturbed me was the one about where they're gonna have to, what was it? They have to show up in order to justify having their Medicaid.
Correct.
So I'll give you a scenario. If you have a client that gets something in the mail and says, you have to be here Friday at whatever time at the social services office to justify your Medicaid for next year. But you weigh that and the person is ESRD and has to go to dialysis. Which one are they gonna choose? And if they don't, and from what the understanding is, if they don't show up to that sitting, they could lose their Medicaid for 6 months.
You know, I can just say, and it's one of the most ridiculous things I've seen, because look, there's easier ways to verify if you qualify.
Yeah,
Look, we have AI now. Like, let's not go too far. I mean, do you really want to bring a senior into the office for a face-to-face interview? I mean, look, if you guys want to, you can have 20 wheelchairs sitting outside, have their homemates bring them in. If that's what you want, it just seems like lunacy to me.
And it's just building, and like I said before, it's just building a bigger bureaucracy, because you're going to have to hire more people to do this.
And
I mean, if you have, just looking at Mount Vernon, there's one office in Mount Vernon, like maybe 10 to 15 people working in there. And you're telling me 250 to 300 to 400 to 500 seniors on the same day got to recertify.
Leave your wheelchair outside, have your home health aide bring you inside.
Can you imagine? Could you imagine trying to do that? So you're obviously going to have to put more money, more assets into those offices to hire more people to actually do this on time. And then the ultimate, and I always say this to people. When I look at that BBB, and I think you said it a couple of weeks ago, it's a death march. It's a death bill, right? I mean, you know, but it is. I mean, when I really look at it, you know, when I look at the sickly pool, and don't think the sick people are all in the city, all in the blue states. No, I could go into red states. I could go into Kentucky and Louisiana and all those states and see people that are going to get cut off their Medicaid and are sick. And they're going to, and the ultimate, you know, the ultimate thing was to have them march out.
I'm going to
ride off into the sunset.
I'm going to go to the hidden animal, and the big
bullshit bill.
The big elephant in the room. And I'm going to say it. Look, you can't run a country like a corporation.
That's right.
And the reason why you can't is because in a country, you have to have social programs, because that's how we take care of people.
Is it Medicare a social program?
Well, look, in corporate is...
But answer that. Is it Medicare a social program?
Sure.
Because everybody gets it.
So here's it. You know, in the corporate world, you're worried about your bottom line. And it's all black and white. Either we made a profit or we didn't. And then it's how much of a profit we made. You can't run a country that way. As a country, you have to, you have to take care of your country. And it's so you can go back and say, well, you know what? Well, those services aren't needed. Those services aren't needed. But you know what? If you're one of those people that needs those services and you're receiving it, you know, you should talk to them, because they'll be like, you know what? But you're getting food stamps and you're getting, you know, WIC. You know what? Do you want me to take you home and see how much my kids eat, and you want to see my paycheck? Yeah. Because look, if you want to get depressed, you know, suffer from depression, just look at my paycheck. That shit will depress you real fast.
Yeah. I mean, how many of our people, you know, are living Social Security check to Social Security check?
Correct.
We have a lot of our seniors that are making the decision to buy food, okay, or keep their insurance.
Oh, yeah?
or pay. I'm
What?
sorry, buy food or pay for their medication.
We got people making. We got seniors out there making the decision that, you know, if they don't, if you know, the OTC cards are used for more than just food.
Oh,
You know, you could use it. Some of them you're able to pay your cable bill. Some of them you're able to buy gas for your car if you have one. Some of them you're able to pay for heating, stuff like that.
but and you know
more
what,
of
Santi,
them,
but let me
more
just
of them.
point-
Hold up. More of them are making the decision that they need that to supplement their monthly food bill.
Absolutely,
Without that,
absolutely.
like I have clients that always come to me and say, "Yo, at the end of the month, and we talked about this. Yo, can you spare this because I need to eat?" I'm like,
but-
wow,
and here's the other thing.
wow,
okay?
and we're cutting that.
Yeah.
They make it seem like it's a lot of money. Like these seniors, they're making a lot of money with these food stamps. Yo, listen, what have you seen food prices?
I
these
think
days?
$750 is the max.
Have you seen food
if
prices?
you're lucky enough to get in and get $750. And then what if you got, you know, not all seniors are living by themselves. You know, if you got family members that are living with you,
Yeah,
you know, I've
the lucky
seen,
ones.
we've walked into some
The lucky
houses.
ones.
We've
Lucky
walked
ones.
into some houses, 2 bedrooms with 5, 6, 7 people in it. You know, and not everybody is able to, you know, as parents, we're not gonna sit back. If I don't care how old you are, we're not gonna sit back and allow, you know, somebody not to eat.
No, man.
We're just not. We rather not eat. We're gonna make.
That's
We're gonna have our kids eat before we eat.
Correct.
But those are the choices. And I don't care. You know, I don't care. You know, I don't care how it cuts. It cuts one way, and it cuts poor. That's what it
Well,
cuts.
We said it, and I you know,
Yeah.
I said it before. You know, that is this bill, and what they try to make it was they try to make it a scalpel.
Yeah.
And you can surgically cut the
Mhm.
fat out of those programs.
Right.
That this bill is by no means a scalpel. This
Yeah.
is a fucking broadsword,
Yeah,
and
man.
it is going to
It's
be
a death
collateral
march.
damage.
And it's not. And I want to get out of people's heads that illegal immigrants are getting Medicare. No, they're not.
Those are the
They're
ones
not-
we're screwing.
Yeah, no, they're not screwing you. You're screwing yourself. You're not being screwed by any illegal immigrants because ain't no illegal immigrants walking into my office and trying to sign up for Social Security benefits. Because when you go to ID.gov or whatever else you go, what's the first thing they ask you for? Your Social Security number.
Correct.
Then your state ID. And I don't know any illegal immigrants. And I like I said, you know, I have a place where they are. I won't say because then, you know, who knows who will show up. That they don't have state IDs. That's another thing that they're asked for when you go to ID.gov. So if you guys want to leave comments that all these illegals are eating up the Medicare and they're eating up the SNAP, that is I will call total BS on that. That is bullshit. No, they're not. So you could come up with all your grievances, gripes, and tell us how illegal immigrants are eating this shit up. But bro, go do your research and then hit me in the comments before you ever say that the illegals are the problem. No, they're not the problem. We're gonna get to what the problem is. We're gonna go over some solutions. So let me go to the next. I think is that enough for market disruption?
That's enough for market disruption.
All right.
We've disrupted
And
the market
I
enough.
think we did the poor versus low income. All right, we did the actual effects that we talked about. People are gonna have to choose insurance or eating, or living, or having an apartment.
Correct.
Or you know, they're just gonna have to choose. And unfortunately, the choice that most people will make will be to eat.
Correct.
And if they don't have a health insurance, you know, what happens? They end up in the emergency room.
Yeah.
What happens with that? The
Yeah.
cost of care goes up.
Yeah.
The cost of care goes up. The hospital goes out of business. The clinic goes out of business.
And-
the doctors leave. Right? How many? I just saw a number the other day of like 200,000 to 300,000 doctors and nurses left the industry.
But you know, and I'm
You
gonna
didn't see
stop-
that?
No, I,
Oh yeah.
I'm going to piggyback on what Santiago just said, and I think that it's important to say that that those tough decisions are going to have to be made by people that shouldn't have to make those
Yeah,
decisions,
correct.
like the elderly, like the single mom
That's right.
who's struggling,
not just elderly, but sick.
Yeah, sick.
who's struggling. They're under enough stress as it is for them to be hit with this bullshit.
Yeah.
It's not right. And you know, I go back to my original. You can't run a country
Yeah.
like a corporation because it's not that black and white.
No,
It's not.
it's not.
Correct.
Running a country is not black and white like corporate.
Yeah.
It's not. There's a lot that goes into it.
Yeah. Right now, we're getting into life and death now. You know what I mean? And I tell my clients that all the time. You know, health insurance is life and death, right? Because I particularly know right now. You know, you walk into your doctor's office, the first thing they ask you for is, you know, what's your insurance?
What's your insurance card?
Correct.
Who's going to pay us is what
Right.
they
Who's
what
gonna
they're
pay
asking
us,
you there is
basically?
who's going to pay us for your care?
Yeah, it's true. I mean, how many people you know? I mean, we had Cassidy on a couple of months ago, and how many people you know can actually self-pay for services?
Correct.
Right? And then wait for a reimbursement. Come on. Like really? Like, come on. Federal government, we got to do better. We got to do better. There's no way that we should be, once again, we went into this last week, you know, or a week before. Why? Quote unquote, everybody sees it. All the talking heads, I see it all the time. This is the richest country in the world. But we got homeless. We got poor people that can't survive. And what's the natural reaction? You're gonna go out there and do what you gotta do.
Correct.
If you gotta steal, you gotta rob, you're gonna do what you gotta do.
Unfortunately.
You know, whatever you're gonna do. It's like what's the word? Something of the fittest.
Survival.
Survival of the fittest right now. That's what y'all telling us from the Fed. It's survival of the fittest. And you don't care about nobody.
And make no mistakes, okay? Whether you have insurance or not makes a big difference when you enter the hospital. And
That's right.
People, we're not ignorant.
No.
And for those of you who have been in the hospital, you know that depending on whether you have insurance or you don't, depends on how you're treated.
And how quick you get served.
Service, man. I mean, you walk in there with grade A insurance.
Yeah.
And
You're the first one taken.
You're first one taken. And you know what? If you have to be admitted, you're going to go to a nice room.
Yeah.
If you don't have
You might get a single.
You're going down to the death morgue, man. It's like, yo, just take that bed there,
You
man.
know, that doctor's in the hospice. Send him there.
Talking
My
about,
bad.
they're gonna give you a couple of band-aids and they're gonna look at you and go, yo, you got time. You can take care of this,
Yo,
right?
take them
It's
to
like,
the
yo,
skilled nursing facility. Yo,
put these on, man.
there's a doctor there. You know, maybe he can help.
If you got insurance, the nurse will come and put the Band-Aid on for you. If you don't, it's like, yo, put these on.
It is crazy. It is crazy, man. I'm so fearful for my clients. I'm so fearful for seniors going forward. You know, like I said, me and Juan, we do our best to help our clients as much as we can. We're not one to hold anything back. If you're in need, I don't have any problems like feeding you or doing anything. I know, you know, people can misconstrue that and say it's against the law for me to do that. But if one of my clients comes up and what did you say? They had a potato in there,
a potato and a bottle of water,
fridge.
man. I'm like, what is
he had
this,
a client
man?
with a potato in their fridge to eat when he went there.
No, I'm gonna make a correction. That she had a potato. She also had an egg
And an egg.
and a bottle of water. I was like,
And how far out was she from the end of the month?
like a good 2 weeks, man.
Yeah, man.
That's unfortunate.
That's crazy.
That's very.
And just going forward, I wanna big up a couple of community companies community service people in Westchester, feeding the hungry in Westchester. Definitely want to acknowledge you guys. Catholic Charities.
Much love
Catholic
to the food
Charities,
banks,
I give a
man.
lot of love to.
Much love
If
to the food banks.
if you're a food bank, you know, hit us in the comments and we'll definitely enlighten people where they can go to eat.
Absolutely.
If you're a pantry at a church, let us know.
Hit us up and we'll put it out there.
We'll put it out there
definitely
for
put it
our
out there.
people because there's going to be, in 2026, there's going to be a lot of suffering, man. It's gonna really take a toll and it's going to hurt. But let me move on, you know, and once again, like I said, and Daniel and Juan know this, like anybody that comes to me and needs help, you know, you become a part of our family, our extended family. I have a lot of clients, and all of y'all know, y'all family to me. But just remember my warning. You know, if you start to vent, I'm gonna vent back.
Yeah.
All right, but let's go. All right, so the next one part of that is we talked about the increase in the level of years. The people from 1959 to 1965 now have to wait to complete 67 years old in order to get their 100% benefit.
Yeah, it's been revamped.
Right, and then people from 1965 to 1970 have to complete 68.
Yes.
So guys out there, when you're applying for Social Security, there's no more 66 and a half.
Yes.
You have to complete 67. And then a lot of people come up to me and, well, if I take it at 65, what's my percentage? 70%. So when you come in, if you come into my office or you come into Juan's office and you want us to do your Social Security application for you, when we go through it, it gets there. It will actually get an outline of how much you can make if you take it at 65 or if you wait till 67. Some people are like, you know what, I really need it, you know, and then we tell you what could be the what could be the downfalls or the pitfalls of taking it at 65. You know, there's only a certain amount of money you can make for the 2 years until you reach 67. And those are all pitfalls. But, you know, when I look at people working at 65, they're working, they get Part A, and then I see some of the plans that these jobs are offering.
Correct.
I would take my money and run, bro. I'll be like, nah, I'm out of here. Yeah. Get out of here. I'll put me on part-time.
Yeah.
Or take me off the books. Yo, take me off the books, because it is crazy. I just saw one plan that was an EPO that two of my new clients came to me, $3,000 deductible, medical deductible for him and his wife. Yeah. $500 a month for both of them to be covered. No dental, no vision, no hearing. $590 deductible, tier 3 and above. Like, are you crazy? That's a union? That's union benefits? And then the kicker.
How much it costs.
The kicker was my favorite. They told him to go get dental from Cobra. To go get dental and vision from Cobra. Wow. I didn't even know Cobra offered that. Wow. Does Cobra offer dental and vision? I did not know that. That was just nuts. So people, and I always say this to my people that come to me and they say, oh, I got job insurance and stuff like that. Please read your benefits. Read your EOB.
Correct.
You have to read it. Just because you worked all your life and you're still working and you get a plan. And
don't be naive.
Yeah, you get a plan.
Yeah.
From your
the
job.
days of your plan covering everything.
Yes. That's over.
No, that's as dead as the dodo bird, man.
Find a legitimate broker and bring your summary of benefits, like myself. We'll read it for you
and tell you.
We'll tell you.
We'll bring you into reality.
Yes,
exactly.
I don't care if you're a union member. I don't care if you're getting private insurance or you're still working and you getting insurance and you just took your Part A. Am I right about this one? The plans change at every business every year.
Correct.
In October, you need to read the new benefits. I saw one lady came to me in Mount Vernon. She had like they gave her like what's that paper that used to roll out and you write on it like papyrus. Like it was like she rolled it out. Yeah, scroll. She rolled it out on my desk. And my desk is a full 4-footer, 5-footer? It took up the whole desk. I was like, what is this? And she was like, these are the plans they're offering me. I'm like, what? What? I was like, I ain't reading this. Are you crazy? She actually walked up and rolled it out on my desk. And I'm like, what is it? And she was like, these are the offerings from my job. I was like, they give you 20, 30 offerings to confuse you or to, what did it? Well, they told me this was the best one. I said, anytime anybody tells you that's the best one, run. Run. Oh, that's real one. I was waiting for the dude to come out. I was waiting for the dude to come out with like with the dolly, like, and then roll out the. I was like, what are you doing?
You do know that there are computers now that all this shit is in there, right?
I don't even know.
They were invited back like in the 80s.
I mean, come on. Then, oh my God, it was disgusting. I was like, can you roll that back up and then go back? Like, yo, come on, man. I was like, yo, who's smoking that? Nah, I was like, that's how bad it was. And I was like, yo, get out of here.
What?
I couldn't believe it. She had like 20, 30 plans on a scroll. It was a scroll.
You can't make that shit up,
It was like they should have put it on a TV screen and just, you know how the scroll keeps coming out?
Is that way? Hold on. You want to go back that up a little bit?
Yeah, I was like, yo, can you stop? Hold up, stop.
Back that up a little bit. I didn't get that part.
You know, like an AI animation would come out and be like, don't do this.
Oh, man, that is hilarious.
Don't do this, Land. Don't do this.
You can't make this up, man.
Like, it would be like Dave Chappelle would pop up. Don't do that shit. Don't do that. Yo, that is crazy.
Let's just make it clear. We're not laughing at the late.
We're not laughing at our clients.
No.
We're not laughing at you, ma'am. What we're laughing at is what they did to you.
Correct.
Because that is ridiculous. And I told her right away. And on a serious note, I was like, you know what? You really need to consider opting out. That's too many plans. That's too many offerings. They're not giving. Each plan has different offerings.
Correct.
Like one has dental, one has vision. Like consolidate. Like how y'all don't how are you working for 25 years at a union or whatever, and they can't even consolidate your plan after you retire, man. They're still spreading it out.
Yeah.
And can I ask you a question, Juan? Even if you opt out, do you still got to pay your union dues after you retire?
Yes.
So they're getting, they're rare. Oh my God, I can't. So please, people, I mean, I know a lot of people, if you have the night chip, no. Night chip, NYS, HIP, that's, if you're federal, obviously, no, we're not going to mess with you. But if you have commercial and you're not, you didn't retire as a federal worker, find a reputable broker and show your plans. But please don't pull out no papyrus on my table. Like I'm working here. Come to my office. Like, no, okay? So
I think that it's the greatest plan in the world, and then walk into my office with like these crazy bills for
God.
$1,000. But I thought my plan paid for everything.
Yeah.
Like, in what world do you think that,
I'm telling
man?
you. And I'm going to say this, unless you have Medicare and Medicaid in a state, you are not covered 100%. There's no way. And I'm going to say this, Part A and Part B pay 80% of hospitalization and medical, not 100%. Correct. So if your job says to you, oh no, oh I love this one, Juan, you're gonna crack up. This person came into me and said, oh yeah, I got 100% coverage. I was like, how you got 100% coverage?
Show me.
No. He said, oh, I got 100% covered because my job covers the 80%. I was like, so can you listen to yourself? Medicare is always first. Am I right, Juan? That's always the primary. So if your job is covering 80% of A and B, they're paying the Medicare's paying them. Correct. The 80%. Correct. So guess what you're stuck with? The other 20%. Mm-hmm. You cannot have 160% coverage. There is no obvious way, right? You can't add 80 and 80 and say, oh yeah, I got 100% coverage. That's 160.
That's almost as naive as people who say, "Oh, you know what? I applied for disability, and my disability, I'm going to get exactly what I get at work." Guys, I mean, know this, okay?
No.
The maximum you can get on disability is 65% of your salary. The
Right.
reason why they cap it at 65% is because if you make the same amount of money when you're on disability than you did working, no one will ever return to work.
I'm telling you.
It's like, oh, I get the whole thing. No, you don't.
Do you know
it's capped?
I'm not really an expert on it, but the workman's compensation, like I'm not versed in it, but some people come to me with their Medicare card and they keep the workman's comp, and workman's comp does do certain things, but not everything.
Not everything.
Right? Workman's comp has to do with the injury. So if you got to go to physical therapy, they'll pay for that, or they'll pay for other things due to your case.
Correct.
Right? And then you pick up a Medicare Advantage plan or whatever you want to pick up, and that covers the rest.
Correct.
All right? And you should still, even if you pick up a Medicare Advantage plan, you still should be getting you should be still getting your compensation from workman's comp. All right? Okay, let's move on, because, man, that really pisses me off. I'm like, people, y'all got to read. Read.
You need a grind my gears segment.
Yeah, man, read. All right. We got to BBB, we got to insurance, we got to okay. All right, let me end, we're gonna end this segment with we talked about the age increases. You want to talk to a little bit about the COLA that they got a 0.4 raise. People, they went from 2.5 to 2. Some people are saying 2.7, 2.9 on the raise of the cost of living adjustment.
Oh,
yeah. But people, just because it says 2.9, no. That's it's a 0.4 increase, not a whole 2 point.
It barely keeps up with inflation.
It's
what Santiago is
just remember, it's a 0.4 increase. So if you take 2.7 or 2.5 and make it 2.9, that means you're getting a 0.5 increase, not 2.9 increase. No, you're not getting that. You're getting a 0.5. And guess what also happens with that? What happens, Juan? What's
Inflation.
the response from the Fed? Inflation. And guess what else happens? You're getting a Part B increase. Most the numbers I've seen so far was 220 to 240.
Is it that
From
much?
185. That's the numbers. Yeah, I heard between 200 to 220.
It's around there, yeah.
Yeah, 200 to between 200 and 240.
I thought they were trying to keep it at 210.
But like I said, between 200 and 240.
Yeah.
I can't tell because they still gotta sign the bill.
Yeah, it's still
in the Fed, the CSR,
yeah,
which hasn't been signed yet. So once that happens, or if it doesn't happen, we'll get to the ACA. If you have state insurance and that thing does not get signed, guess what happens to your tax deductions when you go on the ACA? When you go to get your New York State health insurance, those people that were getting that nice tax write-off, it won't be there anymore.
Yeah.
You'll be paying, people that are paying $500 and then they get, they pay, it says the premium is $900 and then you get a $400 or $500 reduction for taxes. Guess what? Next year, if that thing don't go through, your insurance will cost you $900, right? $900 for you. And then we don't know what'll happen. Will your kids get chipped? We hope they will, but we're not be able to say that because every state might not be able to cover enough chip.
Correct.
So then what happens? Then we go into what we talked about earlier, the living or having insurance. I mean,
Correct.
you can't. If I have to pay $900 in insurance, right, and I'm living check to check, and I'm making $2,000 or $3,000, and I have a living expense in my apartment of $1,000, and then I have my 2 kids that gotta eat. They're gonna choose to eat. They're gonna choose to survive. They're gonna choose their lifestyle over insurance.
Correct.
And then what happens? We went to it before. They go, they get sick. They go into the emergency room. They can't pay the bill, right? So what happens? The cost of the increase in hospital bills goes up every year. We know the cost of care goes up, right? And then what happens? Hospitals close.
Correct.
Clinics close. Doctors leave. Nurse practitioners leave. And we can't, as a selfless, godly individual, I can't sit by and not talk to you guys about that, man. It's just gonna be crazy.
Correct.
But if you have any questions for this segment, please comment.
Yeah, so I just want to say, there's no sort of clear answer to all of these market disruptions.
Yeah.
There's no clear answer that
That's
you
right.
can give to every single situation that's one of your clients.
Yeah.
That's
Every
different.
single
That's
situation
what we're
is
saying.
different
Yep.
and it's unique.
Yeah.
But
As a collective.
Exactly. But as
Go
a
ahead.
collective, one possible solution that you can provide is just staying updated, staying educated, and of course, at the same time, this is me advocating for my brokers.
Go ahead.
This is why you should be finding brokers who are educated on these
Yes.
different issues,
I'm one of those.
and they can help you with them.
I agree.
No doubt.
Because, and I think that
Go ahead.
I'm glad that you said that, Daniel, because an educated broker and somebody who keeps up to date with the new rules and regulations
Yeah.
can give you those options that you need.
That's right.
And one that's not doesn't know about those options.
Correct.
So it's a matter of how informed your guy, your insurance guy, because that's what they call us, is.
Correct.
And I think
And
it's very important.
And I think an informed broker should be like telling you, if you need help, if you have a food deficiency in your house, what in your neighborhood, like Feeding Westchester or places like that, your broker should know these things.
And if you went in and you asked your broker about what effect this bill, the big beautiful bill,
yeah.
would have on their benefits and their service, and they told you, don't worry about it,
Yeah.
look for a new broker.
You're
Yeah,
a rude awakening.
Come on, come to me. Find a new broker. Please. I don't care if you find me. I don't care if you find one. Just find somebody that knows some shit.
If you walked into his or her office and they told you, don't worry about it, run. If you walked
Run.
into their office and you asked them, how is this going to affect me? And they told you how much time you have,
Yeah.
that's the,
Just because
That's the person for you.
just because the office is around the corner from where you live doesn't mean that's the person you need to be seeing.
Correct.
Correct. I mean, anybody, and I'm sorry, I got to do this one. I'm sorry. Anybody hopping out a truck on the street, run.
Daniel,
Not that they're, hold up. Not that they're bad brokers. not that they're bad brokers. Some of them are very knowledgeable, but if you're walking down the street and somebody talks to you and says, "Oh, do you have Medicare, Medicaid? Come on in, let me talk to you," and you walk in, and the first thing they do is open the book and say, "Oh, you know what? This is the highest OTC card. That's what you want, right? Run, because that's not the importance of the SNP. The SNP's important is to keep you healthy, is to give you advantages to go see your doctors, is to make sure you're well, to give you the dental vision and the push to do all the preventative things without a cost.
Correct.
That's what the SNP is for. iSNP, C-SNP, all those SNPs are for chronic illnesses. So they are there to provide a much needed service that will help you as a low income person do the things that are necessary to keep you healthy so that you don't end up in the emergency room and things like that. And the OTC card and all that stuff are extra benefits. That's not the primary benefits of the SNP. That is an extra benefit that if you have food dependency or stuff like that you can use to your benefit. But that is not, and I'm gonna say this again, that is not the important thing with your plan. The most important thing about your SNP plan is that you take advantage of all the services that are preventative. Preventative. The extra benefits are the OTC and stuff like that.
Correct. The supplemental benefits.
Anything else I need to make clear about the SNPs?
No.
All right.
By the way, SNP stands for Special Needs Program.
Or I like to say Special Needs Population, right? Because that's the Special Needs population. All right. So I'm going to end this topic tonight. Thank you, Daniel, of course, always. Of course. Juan Cabrera, my partner, my man in crime. We have been brokers for a long time. We care about our clients. Like I always say at the end of everything, with my clients, you are part of what I consider my Medicare family. I have a lot of family members, and anytime you want to search us out, you can reach me at 914-620-7903. You could come see me at the health insurance store at 929 North Broadway in the beautiful city of White Plains, New York, in Westchester County. My office hours are, quote unquote, 10 to 5 daily, Monday through Friday. If you don't see me there, call that number, 914-620-7903. If nobody's in the office and it's dark, that means I'm probably on a home visit or I'm working in one of my CVSs across Westchester County. Juan, give us your info for Jersey or New York.
I am in New Jersey, the health insurance store in New Jersey at 181 Van Buren. You can reach me at 718-304-3751. The office, we are at the health insurance store group.com. You can reach us through email.
And I just want to make one more before I close it out. You want to?
No, definitely not.
One more thing before I close it out. I just want to say, because I see a lot of doctors hitting my comments, a lot of, I'm looking, if you're a doctor, mental health, I don't care what you are, and you want to sit in for a forum, you're more than welcome to come down.
Yeah. We want to hear from you.
I know people saw one of our clips and they thought we were bashing them. We're not bashing doctors. We just want doctors who care. That's all we want. That's all we promote. And I know people saw the clip of Nicole talking about, her license is on the line. And we totally agree with what Nicole said that day. So I'm going to close out this segment. Thank you, guys. Canada, keep it up. Of course, all of y'all in the United States that love us, come by, hit us, subscribe to the page. We love all of y'all. And we'll be back. Thank you.